discussing health, and this applies to general population as well as high level athletes, is visceral adipose tissue. I just had mine measured. I'll show you in a moment. This is what visceral adipose tissue is. You should know this if you're interested. I mean, if you care about your own health, or especially if you work with clients. So there's different types of body fat. Visceral adipose tissue, meaning visceral body fat. This is the type of fat that accumulates around your internal organs. So it is concentrated in the midsection. What makes this type of body fat unique from other types, such as subcutaneous, which is the layer found just below your skin, is that this type of body fat, visceral adipose tissue, it releases its own pro-inflammatory signals. So it interacts with the rest of your body. It's literally its own organ, which is wild. That's a separate discussion in itself. Fascinating stuff. But in general, visceral adipose tissue increases our risk of virtually all chronic illness. It increases risk for cardiovascular disease, diabetes, prediabetes, because when we have more visceral adipose tissue, not only does it increase inflammation, like I told you, and it actually does so directly by releasing its own pro-inflammatory signals, but it also disturbs insulin signaling and also blood sugar control. It also impairs hunger signaling because it disrupts the hormone leptin, which is supposed to communicate with the hypothalamus of your brain to tell you when you are full. When you have more of this particular type of body fat, however, that signaling is disrupted. So there's a ton of problems, specific ones too, mechanistic ones of visceral adipose tissue. You definitely do not want this. And this is also relevant for athletes. That's right. Now, before I explain this, I'm just going to show you my results very quickly. It's really not about the number. So this is it over here. It is in French, visceral adipose tissue. I was below the average. But again, I'm not showing you this because of the number. That's not really the important part here. What I want to emphasize is I did this with a simple in-body, it's called in-body scan. Literally took less than 5 minutes total from start to printing this off. And that is such a valuable readout for myself, for you, if you're general population, for your athletes, this one single marker. Now, there's other ways to assess this for sure. I'm not even saying this is the gold standard. I have no affiliation with them whatsoever. But this is one reliable way to do it. It's pretty cheap, very accessible. But you can do this, of course, with some people use calipers. Those work great. These would probably be the two most practical options. And it gives you this number so you can track it over time. Now, you might be thinking, well, I'm an athlete or I work with athletes. Why do I care? Well, research shows that levels of visceral adipose tissue can increase throughout the season, even in professional athletes. For instance, I'll attach some studies below, but one looked at professional rugby players and they found that visceral adipose tissue increased throughout the season in both forwards and in backs in roughly 50% of the players. That's significant. If this is your life, you're getting paid for this, or if you just really care about it, that's potential that you are not leveraging, because visceral adipose tissue, remember I said it increases inflammation, it disrupts blood sugar control. Well, that means if inflammation's higher, you're not going to recover as well. You're going to be more prone to injury. You're going to be more prone to just pain and stiffness in general. You're going to be more prone to getting sick throughout the season. And then we can loop in the blood sugar stuff as well. There's a ton of other problems to that from a health standpoint, from a performance standpoint. And so the key takeaway here is one single marker, very valuable, pretty accessible, pretty cheap, depending on where you are, but for the most part, very practical. And then from there, we can develop as coaches, we can develop strategies to lower that. Now, again, this will be different general population versus athletes. General population, oftentimes it's just, are you lifting weights? No. Okay, well then obviously we need to start there. And sometimes you can tell that without this assessment, right? You could sometimes just tell by looking at someone. As a educated coach, okay, yeah, we need to start lifting some weights. With the athletes, the professional rugby player example, this becomes a bit more nuanced. Obviously, they're already lifting. Rugby players, I mean, some of the most, perhaps the most well-rounded fitness on the planet, perhaps you could make that argument. They're doing that. So what tools should we leverage to reduce visceral adipose tissue? And there are specific tools, and this is what I provide in my programs. General tools, more advanced tools, and intermediate options. So this is the health levels. Tools for health that can be applied to all abilities and all levels, just like training with health.